Hi everyone, my name is Stacy Cornett and I'm here today as an infant and early childhood mental health therapist working as a consultant with Head Start to offer you some information that I'm hoping you can find helpful in supporting your young children. Today I'd like to talk about how we recognize that young children may be experiencing stress, especially stress that's difficult and overwhelming. What are some scenarios that are likely to be stressful for children and have proven to often cause children to experience emotional and behavioral challenges? And most importantly, what we can do to help children when they are under stress. So stress is a difficult topic because we all experience stress. We're experiencing a great deal of stress right now as a society and trying to cope with the COVID pandemic. And this topic has brought us to, at Head Start, some concerns about how we can support parents to recognize and cope with children that are under stress in a way that appreciates both the normal stress that kids experience as well as the events that are happening right now with the COVID pandemic. So first I'd like to start with talking about what are some of the scenarios that are typically stressful for children. So we all know that nobody knows anybody's children better than the parents and caregivers that are taking care of them on a regular basis. So I hope as you're listening to this today, you'll think about how this information about just children in general may be specific to the child that you know best, your child. And we always want to put into context the child's temperament, so the things that are kind of default for them, whether or not they enjoy being around other people, how comfortable they are with change, what's their typical mood and activity level. So some of those characteristics that just are default in everyone's children will help us to also understand how the stressors and the symptoms today that I'm sharing with you really may be pertinent to your individual child. So stress definitely is something that is first felt in a child's body. So we see sometimes some complaints about headaches, stomach aches, just general body aches. So just not feeling well. And on a related note, not feeling like they have a lot of energy and the same level of physical well-being that they might have experienced previous to the stress that they're potentially experiencing. In addition to that, they may also have just a general sense of fatigue that pops up, and you're noting it by the child not being interested in doing things like they were before. And this can spill into sleep problems, which can include not falling asleep easily, not staying asleep, having nightmares, or even having something called night terrors, which many of you may have seen in a child, where a child's disoriented and not able to fully make use of the parent that's trying to help them because they don't recognize them, and they may often continue to cry and scream till they fall back asleep. So those are some issues that may or may not be happening in your child, but definitely paying attention to their physical well-being will give you some clues on if they could be stressed. So something that I'd also like to add is what their appetite is like. If they're extremely different in the way that they're eating, where they're more picky, eating too much, and just in general having a big change in their level of appetite. So how a child is feeling and the things that we're noticing in their appetite and their sleep are really important to pay attention to. Then the next thing that we will notice in children is something that most people go to first, which is their behavior. So most of us notice that children are either excessively whiny, cry easily, maybe become easily angered, or have tantrums as a definite sign that they're not doing well emotionally. And when that happens, we need to think of this behavior as a gateway into what the child's thinking and feeling, as the behavior is usually telling us that they are experiencing sadness, frustration, an inability to cope in some way. So those are some other ways that we can tell. We can also tell when a child is clingy and doesn't want to leave a parent's side and is asking for help with things that typically they would, be able to master and not ask you for so much help with. And conversely, we may notice that kids are kind of distant and staying away from us and seem like they're preoccupied, perhaps even worried, and that there's changes in the way that they just appear to be interacting with others. Maybe being distant, having kind of a vacant look in their eye, and asking a lot of the same questions over and over again that sometimes will give you a big clue that they're wondering about what's happening maybe in the household or in the world in general. So those are some additional things. So we have overall physical well-being and appetite and sleep, and physical markers such as how fatigued and how much energy they have. We have behavior, and we also have what the child is doing in their play as a big sign that we can sometimes see some themes that could alert us that there's some worries or preoccupations that the child is experiencing. So when play becomes really repetitive and they're doing the same things over and over again, it could be the child's attempt to use play, which is the way in which they learn and express themselves and absorb information, to tell us that they're stuck on something or worried about something and trying to recreate the situation over and over again to feel better about it. So sometimes you'll see that they'll have a different outcome in the play, or sometimes you'll see that the same thing keeps happening over and over again. It's best when you see that the child wants to play with a variety of toys and doesn't continue to act out the same theme over and over and over again. And when you do see those things, it would be good to bring that to someone's attention, or perhaps look for broader clues to see if the child may need some assistance in coping more effectively or talking about something that could be of concern for them. So let's go next to thinking about what are some of these situations that can be stressful for kids. In the past, we used to hear people talking all the time that, kids are carefree, they don't really understand things, and they're not going to remember things that are stressful. And we now know that that's just a shallow way of thinking about children, and that they do remember things, often not in the same way as an adult. It's not beginning, middle, end. This happened, then this happened, then this happened. It's often fragmented and confused. But kids do remember things, albeit differently. And we need to recognize that when something that causes them confusion, and most importantly causes the family to function in a different way, such as the parents talking about or feeling upset, and the children being worried about their parents' reactions, those are things that can be stressful to kids. So in general, kids have a very egocentric, and that means that they think that things that are challenging or stressful have something to do with them often. So they'll draw this conclusion that I caused this to happen. My mommy and daddy are having arguments because I'm not a good kid, for instance. Or, I'm not in school any longer because of COVID. Perhaps earlier, before school would have normally been out, because of something that they think that they did wrong. So there could be all kinds of ways that children interpret situations that we as adults think that they might understand because we've explained it to them. But will catch on to the fact that they're not completely understanding it when they ask questions that don't make sense, or show you, by directly expressing something that's very confused. And we want to give kids as truthful of an answer without overwhelming them with too much stress or facts that they can't make use of and understand. So we want to give them situations that are developmentally appropriate, where the explanation's developmentally appropriate, and certainly not more confusing or even something that they're going to learn is not even true at all. We want to keep our explanation as factual and simple and developmentally appropriate as possible, because when they don't understand what's going on, they become more anxious. Something that I think kids definitely can be stressed by, that sometimes parents might not pay as much attention to or realize, is just the separation from you as their parents. So when children have to go off to school for the first time and leave parents or caregivers, and now form relationships with other adults, that's a very stressful situation. It's also stressful for kids to have to deal with children their age or close in age, such as siblings or playmates, and having to figure out what are the rules and the ways of coping with frustration with peers, learning how to share, and all of those situations can become overwhelming. And that's leads to some other situations that can become overwhelming, is not having a sense of understanding or predictability about what is going to happen within your environment, whether that's school or home, or, with secondary caregivers, not knowing that, we wake up, we eat breakfast, we then have some free time, we then do some activities with, the entire family. Whatever the scenario is, it's always helpful for kids to have as much predictability and consistency around these routines as possible. And no parent can be perfect in all of these situations, because it's hard. Parents are now often working from home, or trying to stay home as much as possible, and so all of these things can be very challenging. And I think just giving time to thinking about how these situations can be wearing on adults and children can put us in a position to come up with some new strategies for how we can support kids. So now let's kind of go into thinking about, we know how stress shows up. We've talked about some of the scenarios that are stressful for kids, and what can we do as parents. One of the things that comes to mind first is coming up with a statement or a visual, chore chart, picture chart of our routine. All of those type of pictorial representations of what kids can expect can be very helpful. Think about what you've seen the children's classrooms look like, and some of the picture charts that you've seen that say, first we do this, then we do this, then we do this. Some of those same things can be replicated in the home environment, whether it's something you sit down and do with the kids together, whether it's something that you write and refer the children to, drawing some pictures. Whatever mechanism that you take, it's going to be important for kids to hear from you over and over again that we as the adults in the home know that these things are important to you, and we know that you want to know what's going on, so we're going to repeat that to you frequently. And we're going to try our best to stay as consistent as possible. So that doesn't mean that you can never change your child's routine, or that when they go over to grandparents or to a daycare provider or whatever the situation, that they're going to completely fall apart if it's different. It just means give it some thought about how you can help communicate to the child the differences and what they can expect from environment to environment. So another thing that we can do, along with being very predictable and consistent, is to do some check-ins with kids. So if we're going to be doing some work around the house, perhaps even working from home, and expecting kids to play quietly by themselves or with siblings, or to do an activity such as looking at a tablet for a short period of time, or X amount of time, we need to think about how we might first check in with the child to see how they're doing, give them the opportunity to ask questions, tell you concerns that they have, and then do check-ins with kids frequently throughout the day. So many times we're putting in a load of laundry, preparing lunch, doing something like that, and noticing that kids are, continuing to play with siblings or by themselves. And if they are harboring some frustration, maybe, the day didn't offer them the opportunity to go outside, or their sibling was, being extremely frustrating to them. If they're keeping all of those thoughts and feelings inside, and we're not giving them the chance to just be heard and empathized with, that can be really hard for kids. And just as we as adults who may be around an adult that we find difficult, that's not being very flexible or not acknowledging what we're saying, we can only imagine how frustrating that is for a child that has, fewer coping skills and fewer problem-solving skills. So trying to kind of keep the situations as manageable as possible is really helpful. And when kids do come to you with concerns, I think that, we all, can't be dropping things at the drop of a hat every single time. But of course, when we have the opportunity to be present and connected and listening to kids as often as possible, of course, that's better. But if we're not, and if we're in a situation where we can't give them attention, to say to them, I'm going to be checking in with you in just a few minutes. I have to get something finished. I won't be forgetting about this. And if you get worried that I'm taking too long, you can look in the room and see that, I'm still working on something, or even ask me. But give them a way to kind of know that you're going to allow them to, kind of hold you accountable to checking in on them at a later date, as you just promised. And when you do check in with kids, I think it's helpful to not try to go into a teaching or disciplining or redirecting mode right away, but giving the child a chance, just as you as an adult would want a friend or a partner to connect with you and listen to you. We want to do the same for children. So I think of a couple of things, and I think of the first word as being connecting, then listening, then empathizing, and then doing some shared problem solving. So the first one, connecting, means that you take the child to a place where you can have some eye contact and some private moment. So if there's other kids in the house, to be able to say, Tyler and I are going to be right around the corner, and that Tyler gets to experience you as fully present and listening to him and letting him know that, you're here as promised to listen to what he wants to tell you. And then I think after you connect, you do some really careful listening. Say, what is it that you want to tell me about? And I think it's very helpful to Let them say everything that they want to say. Often kids will become so much less stressed if they're just able to get their thoughts out of their head and express themselves. And after they've told you what they're stressed about, I think it's a nice strategy to repeat. So what you're telling me is that you were doing everything that I told you to do. You were trying your hardest to share with your brother, and no matter how hard you tried, he kept taking your stuff. And even though you were doing all the things that I've told you to do in the past, it just wasn't working. Is that what you're telling me? And let them say yes or no or add to it. And then I think it's nice to then go to some empathy, which is that's really, really hard when you're trying your hardest. And I can totally understand why you came and asked me for help, because that really does feel bad. And I'm sorry that you had to go through that. And then say, can I tell you some of the things that I've noticed that you've done in the past that have been helpful? And let the child partner with you. Let them say, yes, mommy, or daddy, I'd like to hear what you have to say, because you're kind of asking them, slowing down the train, and then this is your chance to then say to them, I've noticed that sometimes you're very good at walking away when the scenario gets too much. Sometimes I've noticed that you'll make deals and give in a little bit where you've been really wanting something to be a certain way, and sometimes that's worked well for you. This gives us an opportunity to feed them a little bit with some things that we've already observed without getting too much into a lecturing mode. And then I think the next step is to say to children, especially preschool age children that are trying to learn to be more independent, what do you think would work in this situation? Can you tell mommy or daddy what you think might work? And let them just kind of brainstorm it. Let them tell you what they think would or wouldn't work, because all of these activities is serving to both get the child to feel that you're listening and connected, but you're actually giving them time to kind of calm down without having to listen to a lot of, you're not being appropriate, here's what you should do. That just kind of shuts them down right away. And then after they tell you, well, I don't know, I want you to fix it, then you might say to them, do you think this would work, or do you think this would work? And tell them at the end of our conversation, I think we have to pick at least one thing that you're going to try to handle this situation better. So the key in what I'm saying today is spend some time acknowledging and connecting with kids, listening hard, empathizing, giving them some strengths and some things that you've observed, and then doing some shared problem solving with them. And that's something that you'll see your teachers doing with your children in your Head Start classrooms. And many of you already operate in this way with your kids. And the more that you practice this with kids without just being too directive and going quickly to an explanation of what they did wrong and what they need to do to fix it, you're really going to develop better problem solving skills as well as better regulation. So I'm going to end today with just, a quick overview that we've talked about the ways in which children show us that they're stressed through the way their body is experiencing things such as eating, sleeping, and their physical activity, and then what their behavior is telling us. And then we talked a little bit about what are the situations that are stressful for kids, such as separations, changes in routine, changes in consistency. And then we've talked about some things that we can do to help stabilize kids, such as learning how to communicate with them when they're frustrated in a way that they're going to hear us a little bit better. So I do plan on doing some follow-up videos related to some more information about when you may see that your child is having problems that could benefit from an assessment, and what an assessment would look like, what are the types of behavioral health problems that we may see in children, as well as a number of parenting strategies that we can put in place when kids are experiencing very difficult and challenging behaviors. So I look forward to talking to you in the future via this video format, and I hope that you found this information helpful today. Bye-bye for now.